Good morning, everybody. It's great to be with you once again. When I moved to Washington years ago, somebody very smart said to me, watch out for those years divisible by 4. They are really interesting years, and I think we can all agree this one has been a very interesting one indeed. Now, you might think that the most important issue on the agenda this year is whether one guy loves his Portuguese water dog so much that he would not put it on the roof of a car to drive it on a family vacation, like another guy who did that with his Irish setter. But as we all know, and as all of you know well, there are many, many more important issues at stake. The fate of the fiscal future of this nation, what we're going to do about federal budget deficits. We know we have a very interesting Supreme Court decision coming up, probably towards the end of June, with respect to the Affordable Care Act. And those of you who listen to the oral arguments know that the justices have been learning a lot about what goes on in the health insurance business, including the fact that it's not a good idea to wait till you're very sick or even terminally ill to buy health insurance. That's, as many of you will know, is a very practice that doesn't usually get you the best possible result. We know that many women's issues have been on the table this year. Many of you will be aware that the members of Congress and others have recently discovered that women do have sex. And sometimes for a reason beyond being fruitful and multiplying. It's not clear that they've heard the phrase yet. Sorry? Yeah, well, I don't know that they've heard the phrase, it takes 2 to tango, much. And as we know from what's going on just here in Virginia with respect to interesting legislation now that has been passed with respect to what has to be done before one has an elective abortion. I'm hearkening back to what Jon Stewart says, which is he remembers that Ronald Reagan used to say that the 10 most dangerous words in the English language were, I'm from the government, I'm here to help you. But as Jon Stewart says, it now turns out the 10 most dangerous words are, I'm from the government, this will be a little cold. As I say, it's interesting. And now we're going to have a really interesting discussion with a bunch of very interesting, savvy, smart people. Let me introduce them to you, and then they're each going to give a few minutes of brief remarks before we engage in a rather robust discussion. First of all, right here immediately beside me is Mark Halperin, who's the editor-at-large and senior political analyst for Time magazine. And all of you who watch television will know that Mark is a senior political analyst for MSNBC, where he appears regularly on Morning Joe and other programs on that cable channel. Before joining Time in April 2007, he worked at ABC News for nearly 20 years. He's covered 5 presidential elections and also served as political director for ABC News from November 1997 to April 2007. He's also the co-author of the New York Times #1 bestseller, Game Change, Obama and the Clintons, Palin and McCain, and the Race of a Lifetime. So we're delighted Mark is with us. Next to Mark is former Congressman Michael Castle. He's not only a former congressman, he's a former 2-term governor and a 9-term congressman, as well as lieutenant governor and deputy attorney general and state senator, all from Delaware. He's our Delaware contingent here today. He's a partner in DLA Piper's government affairs practice at present, and maintains offices in Wilmington, Delaware, Washington here, and New York. He's always had a deep interest in many topics, including financial services, healthcare, and energy. And throughout his public life, he's worked across party lines, building bridges and forming coalitions to move the country forward. During his 9 times as Delaware's sole member of the House of Representatives, he served on the House Financial Services Committee, among others. And in addition to that, beyond the financial-related sector, he played a key role in enacting many important federal laws. For example, instrumental in helping to pass and write welfare reform, the Balanced Budget Act, child nutrition programs, the No Child Left Behind Act, and campaign finance reform to name just a few. So we're delighted that Congressman Castle could be with us. Next to him is Judy Feder, who's an Institute Fellow at the Urban Institute and a professor of public policy at Georgetown University. She previously served as Dean of the Georgetown Public Policy Institute. And Judy, as all of you will know, is a nationally recognized leader in health policy, has made her mark on the nation's health insurance system, both in terms of scholarship and public service. She's a widely published scholar. Her health policy research began at the Brookings Institution, continued at the Urban Institute, flourished at Georgetown. She was actively involved in promoting health reform as staff director of the Congressional Pepper Commission in 1989 and 1990, and then went on to serve as Principal Deputy Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services during the administration of President Bill Clinton. So join me in welcoming Judy as well. Also with us is Ruth Marcus, who's a columnist and editorial writer for the Washington Post, specializing in American politics and domestic policy, and clearly she's had an interesting year of it. Ruth, we're going to look forward to hearing about that. She's been with the Post since 1984, having joined the national staff in 1986, covering campaign finance, the Justice Department, Supreme Court, and the White House. She served as deputy national editor for the Post, supervising reporters who covered money and politics, Congress, the Supreme Court, and other issues. She joined the editorial board in 2003 and began writing her regular column in 2006, and it is indeed a must-read here in Washington. And finally, Carol Matika is with us. She's the National Breast Cancer Coalition's Massachusetts Volunteer Field Coordinator, and she leads that state's grassroots advocacy efforts to further the NBCC legislative and policy agenda. Since her breast cancer diagnosis in 1994, she's been involved in many NBCC initiatives, including development of quality care guidelines and measurements. She's also a faculty member of NBCC's Quality Care Project Lead. She served as reviewer for the Department of Defense Breast Cancer Research Program, the California Breast Cancer Research Program, and as a consumer advisor on several breast cancer research grant proposals. She's also a founding member of Care Advocates at Tufts Medical Center, which is a patient advocacy group that promotes consumer involvement in designing and developing programs for breast cancer patients and their families. So, Carol, welcome. It's delightful to have you with us as well. So we're going to start with Mark. Mark, give us your sense of how things are going to play out in this very interesting year divisible by 4.
All right. Well, Susan, thank you very much for that very nice introduction. You read it just the way I wrote it, which I appreciate.
Happy to help.
You were nice enough to mention my book, Game Change. You did leave out that it makes an ideal Mother's Day gift. So just want to get that in there. Thank you all for inviting me and for being here. You know, we think a lot of us think of presidential politics, or some people do, as a horse race and as a spectacle, and it is that to some extent, but it's important for the country. And the country right now is as divided politically and as fractious politically as it's been in my career covering national politics and government for 25 years. And that's, I think, mostly a negative thing. I think a lot of the challenges the country faces now are the product of the fact that Washington is more divided than the country, but the country is relatively divided as well. You all are doing something great and admirable in a democracy, which is you're giving up time to work on something you believe in, to get together and to strategize and to try to figure out how to exercise your First Amendment rights and other rights to change the country in a direction you think is important. We've seen a lot of that in the last few years, and that's, I think, one of the good stories in the face of what for most of government and politics has not been particularly uplifting and good for the country. Just in the years President Obama has been in office, we've seen the Tea Party movement, which at its core stands for trying to reduce the deficit and the debt for future generations. I think that's a moral issue, and it's one that has been adopted not just by people you would think of as on the far right, but President Obama and Nancy Pelosi and Harry Reid and other Democrats, almost to a person, talk about that as an important moral issue. And that was driven onto the national agenda by people who went out in the streets and organized and did the kind of things you all have done here, and I think that's great. We've seen another movement more recently, the Occupy movement, another moral issue, that we have income inequality in this country that's not sustainable as an economic model, but also is, for a lot of people, a moral issue of too few people in this country have such a large concentration of the wealth. So there's a lot of ferment out there. There's a lot of energy, and we've seen several elections in a row where change is what voters seem to have on their mind. Very different change in 2008 than in 2010. And so the biggest question in some ways for this election is, given the unhappiness with Congress, 14% approval rating, given the divided nature of government and the frustration on the part of a lot of Americans that Washington isn't addressing most of our fundamental problems and challenges, what kind of change will voters want? The outcome is very much up in the air, and I don't think anyone would be wise to predict the outcome. I think the most likely outcome of the federal elections are status quo. The most likely outcome is the president's reelected, that Congress, the House stays in the hands of the Republicans by a narrower margin. The Senate stays in the hands of the Democrats, but by a narrower margin. And I think all of us interested in the election, whether you've got a candidate you support or not, what's important for the country is we get an outcome where there's at least the possibility that people can work together, that there can be the kind of compromises, the kind of negotiated bargains on the big issues, particularly debt and deficit spending and health care, because until those issues are addressed, I don't think any other major bipartisan compromises are possible. Can we get an outcome where those things can happen? It's hard to see, even if you're the most optimistic person, what outcome would be the most conducive to that. That's at least a plausible outcome. I don't think either party is going to have an overwhelming victory. I don't think it's impossible to see either party having 60 votes in the Senate, which, as you all know, under the way the Senate works, would be required to actually get anything major done. When Governor Romney talks about repealing Obamacare, assuming the Supreme Court doesn't strike the law down, it's impossible, really, as far as I'm concerned, for him to just outright repeal it, because some Democrat, I think, would filibuster any attempt to change it in its totality. So I support people looking at these candidates, a lot of areas, what kind of leaders they are, their experience, et cetera. But for all offices, I think it's important to ask people and ask the candidates, or look at and evaluate them this way, to say, what commitment do they have to actually seeking compromise? There are great leaders in this country who've lost their jobs in the last few years because they simply talked about compromise. And
not to mention any names,
yeah.
right?
And the reality is, President Obama has a ceiling on his support, which threatens his reelection, keeps him from governing the way he'd like to do. A year ago, he got Osama bin Laden, something that was incredibly emotionally important to the country, something that the previous president had not been able to do. And after he got him, his approval rating went up to about 60%, just about a 10 or 15 point increase, then came right back down. If you think about President Bush 41, after the Gulf War, his approval rating went up in the 90s. His son, after handling the aftermath of 9/11, his approval rating went up in the 70s. And both of them were able to get some things done in the short term to bring the country together. This president's approval rating went up just a little and then came right back down. And I asked myself after that, what could President Obama do more dramatic, more compelling, more emotional in the public interest that would unite the country? And the only thing I've been able to come up with is if he successfully repelled a Martian invasion. I think it's possible that the country would come together. I also think, given how divided we are, that Sean Hannity would say that the president had projected intergalactic weakness and basically invited the Martians in. So we're very divided. And I think, again, without knowing the outcome of the congressional races, I'll finish by saying, look at Mitt Romney and his record and what he talks about. Look at the president's record and what he talks about. Look at the fact that they're both going to have hundreds of millions of dollars of negative ads run against them, and ask yourself, who can actually make government work to fund the kind of programs in a balanced way, bring in new revenue, which is essential, get the economic growth going again, but to fund the kind of programs that you all are concerned about, not just now, but in the medium term and the long term, working with the other party, because otherwise we will just continue to have gridlock. Thank you.
Mark, what you're suggesting is the status quo, only a little worse, it sounds like, with a little bit narrower margins or increased margins, I guess you said. Let's clarify.
Narrower margins, but fewer centrists, and a more in a way, you'd think narrower might be less polarized and more subject to compromise. But if you look at who's likely to take the seats, we're going to be in a more polarized situation. And again, I think we're going to be led by a president, almost certainly, who is going to face a real challenge of controlling probably one chamber, same party controlling one chamber of Congress, but having an effective veto by the other party without the ability to compromise very much. I hope I'm wrong. I hope there is a path that I don't see right now, but that's, to me, unfortunately, the most likely outcome. And it's going to take a president who, in the beginning of his term, having been elected, or in the president's case, reelected, who's willing to say to the country and to his own party, you know what? We have a mandate of sorts, but my biggest mandate is to try to make the country work, to try to get Washington to start addressing tax reform, deficit reduction, health care, whatever the Supreme Court decides, immigration, energy, education, et cetera, et cetera. And the only way to deal with that rationally is to be magnanimous and reach out to the other party, even in victory on my part, and say, we're gonna find some compromises in those first few months.
Congressman Castle, do you see any prospect of that happening?
Well, I think there's some prospect of it happening, and I agree with practically everything that Mark said, although he made an announcement about a Martian invasion, which I did not know about until I arrived here this morning. So I'm a little worried about that now.
So we call in the journalism racket a hypothetical.
You know, speaking from the congressional point of view, I tend to agree with what Mark said. I can't imagine that Republicans will not still be in control of the House of Representatives. It would take, I think, a change of 25 or 6 votes or positions to do that. It's about a 50-vote margin right now, and I think the exchange is going to be in the 5 to 10 grouping one way or the other. In the Senate, there is a real chance that Republicans could take control of the Senate, but that means, you know, 50, it had to be 51. Otherwise, Vice President Biden could cast the deciding vote. But that could happen. I mean, the reason is that a third of the senators are running, and most of the ones who are running this year are Democrats. So there's more opportunity for Republicans. And I think the presidential race is just as the polls show this morning. It's dead even at this point. That could change dramatically. I still think it depends upon the economy and things that we don't know about right now. But I want to talk, if I may, a little bit about what you're here for, and I'm delighted to be here with you, and I have great empathy for your reasons for being here, and it's great to see all of you. But I would hope that the Congress of the United States would continue on a path that is a little different than what Mark has said and maybe what I have said, in that when you talk about dealing with problems of the actual health care of people, not the Obama health care legislation, but the health care of people, particularly in like medical research. And I'm also on the Research America board, which is very active in this area. And you go to their offices, and many of you have done this, but when you go to their offices and you go in and you see either the member of Congress or perhaps their health care legislative assistant or whatever it may be, you're going to find that virtually every one of them will at least give lip service, and in my judgment, actually feel that they want to help people with their health care issues. And one of those ways the federal government can do that is in health care research. It is the NIH, the National Institutes of Health, which have made a vast difference in terms of some of the developments that have helped with the treatment of breast cancer, as well as other cancers. Obviously, the CDC is vitally interested in this. If you look at your local entities, it may be a university, it may be a hospital. I was just reading a brochure from our biggest hospital in Delaware this morning, and essentially talking about cancer and the treatment that they're giving there and the various studies that are going on there now. This is happening all over America, and we are beginning, in my judgment, to make progress in this particular war. I'm not saying we're completely winning it, but we're certainly making progress. We are now, in many instances, treating cancer in this country in ways that couldn't be before. Many people are alive today who wouldn't have been alive 50 years ago. There is a lot of transition from one cancer study, one cancer solution to another, which is very helpful. We need to remember that. It's not just breast cancer and not just some other form of cancer, but it's dealing with cancer in general, and we're doing better with that. Are we going to be able to prevent it at some point in the future? I mean, your guess is as good as mine as far as that's concerned. That may be beyond the lives of any of us, but at some point that may happen. I was very involved with embryonic stem cell research. That's a political problem, frankly, because the use of the embryonic stem cells was translated into be the taking of life, and there it became a pro-life issue, and as a result, we had trouble getting it through. But we got it through the House. I was the sponsor of it. We got it through the House, and then we got it through the Senate. And President Bush, the second President Bush, vetoed it. And then the next year, Diana DeGette, who's a Democrat from Colorado, who's my co-sponsor, was a sponsor, and I was a co-sponsor. We got it through again, and President Bush vetoed it again. And I think that's too bad. I think it should have moved forward because it would help so much with research. But having said that, President Obama has done an executive order which has allowed this research now to move forward in the United States of America. And so we're starting to see more of that. And you have stem cell research and you have embryonic stem cell research. And it's the combination of these kinds of research which ultimately can make a difference as far as the lives of many people suffering from a vast array of illnesses in the United States, including the production of pharmaceuticals, as well as knowing more about the makeup of human beings. Obviously, the human genomes made a huge difference in terms of understanding where we are going. There's much more understanding today. The use of computers, even in labs now, they can do a lot on computers and don't have to worry about all the older experimentations which took place. There's very many positive things. But
and
the important
Congressman
message,
Kessel, how much do you think the current Congress values the investment in research? We have the prospect now of flat funding of the NIH as far as the eye can see. This community, of course, is very eager to see the defense monies that go to breast cancer research reauthorized. Is there much of a commitment to continue to fund this research across the aisles?
I believe that there is a fairly strong commitment to it. There's counter-prevailing things going on here. One is what Mark said. There's also that whole business of we've got to do something about balancing the budget, reducing the deficit and the debt of the United States of America. We're all dealing with that in some way or another. So if you're going to have more money in medical research in some way or another, you may have to take it from defense, which is a problem with some Republicans, for instance. But having said that, again, you will not go to a congressional office in which they won't at least give lip service, and I truly believe they would like to help with medical research. Know your facts. You maybe have anecdotes, know your stories about how medical research has advanced something which has helped people keep alive. That is very hard for members of Congress to fight. Remember, it was of all people, Newt Gingrich, who actually led the fight. I'm not sure he's the first one to say it, but he led the fight about doubling the funding of NIH, about a dozen years ago or more, maybe more than that now. And that actually happened over a period of 3 or 4 cycles. And, good Lord, if Newt Gingrich could be there, I would hope that any conservative Republican could be there.
Okay,
I
that's
happen
an
to be a
invitation,
Republican.
folks.
I'm not a Tea Party Republican. I'm a moderate Republican. But the bottom line is that some of the Tea Party Republicans who are elected have turned out to be good members of Congress and actually fairly reasonable in their positions. They've sort of understood they need to help people. So don't be shy. I mean, you in this room represent probably most of the congressional districts in this country. And I would hope that you would take the opportunity to talk to your member of Congress. And if you can't talk to them here while you're here, then perhaps something is going to happen at home where you can go by and just speak to them and constantly talk to them about the need to make sure that we are funding medical research. And by the way, there's going to be a lame duck session. That's when most of this is going to happen. And then next year, and I agree with Mark, I just hope that whoever's the next president can be a leader who can bring everybody together so that we can move forward regardless of which party it is. But they're going to have to continue to deal with the deficit issues and what they're going to fund or not fund. And I would hope when those members of Congress and that president get together, they're going to understand the significance of medical research and breaking it down from your point of view of research in the area of cancer and breast cancer, and make absolutely sure that we're continuing to make what was reasonably good progress over a period of time.
Well, speaking of moving forward, the clock is ticking now, Judy, toward June when we anticipate the Supreme Court ruling on the Affordable Care Act. What's ahead and what's ahead beyond that in the election and the aftermath?
Well, Susan, as you know, it is a weird time in health policy politics. This group had a lot to do with the passage of the Affordable Care Act just a little more than 2 years ago, after 100 years of trying. And here we are fighting tooth and nail for its survival at the moment and its successful implementation. And if that weren't enough of an unfortunate place to be after such a victory, at the same time, we are facing a severe, serious challenge to the health insurance coverage that we had before we enacted the Affordable Care Act in Medicare and Medicaid, with the powerful pressure to reduce the federal deficit. Now, the battle on ACA, I am, after all, a political scientist. It shouldn't really be surprising that if it took us 100 years to pass the law, that the controversies would continue after the law is passed. The conflicts about the role of government and the interests of stakeholders don't just disappear because we passed the law. They persist and they persevere in challenges to Obamacare as a government takeover of American medicine and between us and our doctors. Now, to me, that's sort of like the Martian invasion. The irony of it is really quite real, because the Affordable Care Act is not remotely a government takeover of medicine. The Affordable Care Act was very carefully designed to build around and preserve the primary source of coverage that most people count on, employer-sponsored health insurance. It is very much state-based in its implementation and in responsibilities, and it aims fundamentally at making insurance markets and medical markets work for people, not to have government take them over. The irony continues in terms of the battles, because the challenge to Medicare and Medicaid comes at a time when per capita cost growth in those programs is pretty much at the lowest rate it has ever been, much slower than healthcare cost growth in the private sector. It's really the growth in the populations being served. The baby boom generation, proud to be at the forefront, it signed up for Medicare just the other day. The baby boom generation is expanding the roles in Medicare. The recession has expanded and continues to keep high the roles in Medicaid. And it's that enrollment that is now a powerful driver of healthcare, of federal healthcare costs, federal and state, and behind the budget pressure. It really is the number of capitas for the first time as much as the growth in per capita costs that's driving government healthcare spending. Now, the fact that I find, and I hope you will join me in finding these battles ironic, doesn't make them less real or less consequential. What matters in this election and on these issues, and I believe them to be moral issues, which both of you have been addressing, is which of two very different visions of the role of government in affordable health care will prevail in these battles. Governor Romney, in sync with Republican congressional leadership, whose position on these issues is most regularly articulated by Congressman Ryan, Governor Romney fundamentally questions a government role in health care, painting it as an obstacle to Americans' health security.
Having used the instruments of government while he was governor of the state of Massachusetts.
Absolutely. I'm going to get to the irony of that in just a moment, because irony is my theme, and you're quite right. So in its stead, and despite what he did in Massachusetts, he has become an advocate of self-reliance in the marketplace, advocating privatizing a future, Medicare in the future, shrinking Medicaid and turning its overs to the states, and undoing Obamacare. Now, it's not an easy task, as you note, Susan, for Governor Romney to pursue that line, given that Romneycare really was the model for Obamacare, and I myself find Governor Romney one of the most articulate spokesmen for the importance of the individual mandate on the political scene, which is amusing on some level. And his challenge also in this task is very real, given the threats the Republican budget poses, especially to seniors who hold Medicare and Medicaid and its long-term care protections pretty dear. But the truth is, as we know, and you are alluding to, Susan, President Obama's got a tough task selling his vision with the Affordable Care Act, sadly not the most popular law that's ever been passed. The Supreme Court challenge still in limbo, and we'll learn soon. And the need for never popular revenue increases to sustain the health care promises, both the new and the previous promises that this nation has made. Now, I don't know which of these two visions is going to prevail, but I do know that people who, like us, really believe that we need government to secure affordable health care for everybody and to make insurance markets work. Exactly. We need to make our voices heard in this election because if it goes bad, we're going to be worse than back where we started from in 2008. Thanks.
Well, and Judy, in an environment where, as you said, the majority of Americans oppose the Affordable Care Act, although when you ask them, of course, about the specifics, they're in favor of all the specifics. They're just not in favor of them when they're all put together.
Just don't like the name. Right, that's one of the...
But also, 1 in 7 Americans thinks that the Supreme Court has already ruled and has thrown out the law. How do these folks overcome the lack of awareness among the public, let alone this din of opposition to the Affordable Care Act to make a difference?
Well, this group is in an extraordinary position to communicate to the American people what's at stake and that we need to be active to protect the values that you advocate. We know from polling data that people trust as communicators more than anybody else on this issue. People who have experienced illness and who know what it means to have a challenge in getting insurance coverage to protect them, to get the costs covered that they are incurring as part of their treatments. So whether it's politicians, they don't trust them, us at all. When I'm speaking as an analyst, not a whole hell of a lot. It is doctors, nurses, health professionals, yes, more so, but most of all are people who have actually found themselves in the circumstances that the Affordable Care Act, Medicare, and Medicaid address. So what I would say then is that you are raising your voices or gently using your voices in your communities is hugely helpful in letting people understand what's at stake. And in terms of influencing your candidates and elected officials in terms of the path they follow as to why what you care about matters so much.
Great. So Ruth, how do you see all of this playing out, and particularly with respect to these issues involving women that we've been discussing? How does this shake out? How does this translate into returns at the polls in November?
Sure. Well, first of all, never follow Judy on a panel. Second of all, thank you all for your work. My mother was diagnosed with breast cancer when she was 32, and I was 8. She's still here, thank goodness. Yeah. And, which I don't think I realized at the time how miraculous that was, because the notion that she had a life-threatening illness never occurred to me. I was apparently a fairly dim-witted 8-year-old. But I've lived with the consequences and specter of breast cancer all my life, so thank you so much for your work. I'm going to mostly talk about women, but I want to sort of briefly touch on 2 other issues that I also spend a lot of time thinking and writing about. The first is something that the congressman talked about a little bit, which is the politics of austerity in the political universe going forward. And I wish I could be quite as sanguine and optimistic as he is. I think you have to be an optimistic person to be a moderate Republican these days.
That's true.
About the future of healthcare, health research funding in an environment that is going to be just severely, painfully resource constrained. Newt Gingrich doubling the budget for NIH. That was old Newt, new any other. It is going to be impossible to find enough money to cover the needs to go around, both in serving vulnerable populations, making the kind of investments that the president talks about in education and infrastructure and in research. And it's going to be particularly difficult to do that without a sort of bipartisan, I wish we had more castles, but we don't, without a bipartisan agreement on what to any rational person is the fundamental fact that we both need to raise revenue and need to cut spending, and without that consensus, we really can't go forward. But I wish I could leave you with a message on that, other than be very, very nervous about funding. But my next point is going to be about the Supreme Court, which I used to cover, and it's actually going to be the opposite of be very, very nervous. We should all be nervous, and you should not count on my prediction, but I will go out on a limb because I've inched out there before, so I might as well stay and say that I actually think that my prediction is that the court is going to uphold the Affordable Care Act. When it does, please think of me. My real limb is I think if it does uphold it, there's a reasonable chance that that will be by a 6-3 vote rather than a 5-4 vote. But, you know, as Justice Brennan said, the most important thing about the Supreme Court is the ability to count to 5. So I'd settle for 5. If they don't uphold it, of course, this never happened. The reason, I think, is a combination of law and politics. There is no clear precedent, but the precedents on the Commerce Clause, which I've spent a ridiculous amount of time on, argue for upholding the law. And I think the politics of it are this, I don't mean partisan politics, I mean sort of the politics of the Supreme Court in our national system are such that the court is going to be very hesitant to take the, I'm going to use President Obama's word, but not in the exact way that he did, take the rather extraordinary step of invalidating this law, which does, after all, regulate something that is quintessential commerce, 17% and rising. It's probably risen to 18% while we've been talking, though Judy's point about costs of being under control is true of the national economy. I do think that this is going to be the bizarre point, so I'm going to go back from my brief positive moment to being my usual negative self. It's going to be a little bit of a lose-lose for the president either way, which has to do with the polling on the Affordable Care Act. If the court strikes down the law, it will ratify the view of one party that he's an out-of-control socialist who needed to be reined in by the Supreme Court. If the court upholds the statute, it's going to energize a lot of people who are upset for reasons I really can't comprehend about the individual mandate. The thing that's striking about the polling on the Affordable Care Act is that if you look at the overall polling, people are pretty evenly split on it. But the individual mandate is remarkably unpopular. It's unpopular among Democrats as well as Republicans. So I think the politics of this and the timing of this, we needed to get it decided. We need to know sort of what our route is going forward, but I don't think they're great for the president either way. I have to say I do hope that they're good for the country in the sense that the court will uphold the Affordable Care Act. So now the really interesting, endlessly interesting subject that you wouldn't have necessarily thought would come up in this campaign as much as it has, given that other than Michelle Bachmann, who was with us, and now I'm speaking as a journalist, not as from personal opinion, Michelle Bachmann was with us as a presidential candidate for all too brief an amount of time, because it would have been fun to have her around for longer. But here we have an election that has had a remarkable focus on women and women's issues and the women's vote, even without a serious candidate of the female persuasion in the race for as long as we had the last time around. And I think that's due to a sort of odd confluence of events which started really in this election cycle in a way that was seemingly outside the election with the controversy over Planned Parenthood and Komen, which I think was a sort of distant early warning sign about the power, dare I say, of women in the election, the fierce views of many women, not about abortion rights, which is where Planned Parenthood becomes controversial, because women and men are pretty evenly split on abortion rights, but on the power and importance and fundamental importance of contraception and access to contraception. So we had our first little skirmish over Komen. Then it looked like I thought the administration was digging itself into a bad place by not making its exemption for contraception for religious institutions broad enough. Then Rush Limbaugh managed to race to the rescue of President Obama with his words on Sandra Fluck, which then Mitt Romney managed to very characteristically, from my point of view, not do himself a service by managing to only say, well, it wouldn't have been the words I would have chosen, which makes you wonder, well, what words exactly besides slut and prostitute, harlot, fallen woman, and, and then you had the magnificent spectacle of the House Republicans further shooting themselves in the gender foot by having a panel on contraception composed entirely of men. And so then you have, and of course, Republicans really are not the only ones who manage to shoot themselves in the foot. Democrats do it routinely despite their views about gun control, or maybe because of their views about gun control. And so you had the latest little flare-up in the gender wars came with Hillary Rosen and her comments about Ann Romney, how she had never worked a day in her life. The interesting thing I thought about Hillary's comments were not the comments, but the swiftness with which the Obama people in the administration, the president, the first lady, his campaign manager, everybody he knew, I think, drove the bus back and forth as quickly as they possibly could over Hillary Rosen for saying that Ann Romney had never worked a day in her life. And there was a particular reason that they did that, and that particular reason is called suburban women. Some of you may be suburban women. I have worked a day in my life, but I've also been at times a stay-at-home mom. I think the mommy wars are greatly exaggerated, but they're like these trash fires in New Jersey. They always, they never go out. They just flare up next to the turnpike. If anybody's upset, I'm from New Jersey. It's why I'm allowed to say it. And the reason, which gets me to the final point I want to make, which is about the importance of the women's vote in this election. We have lived with a gender gap in presidential politics since 1980, but this year, and you can, if you're a Republican, win without winning the women's vote, just as you can win without winning the women's vote, just as Democrats can, because that's what they have to do, manage to win without women winning the male vote, and particularly the white male vote. But the gender gap, because of all what we've talked about before, and because of its sort of structural nature, promises to be particularly large this election. There's a couple groups that are particularly important within that. One are single women who tend to vote particularly Democratic, may care particularly about contraception for obvious reasons, but also are under-registered and under-voting. And so to the extent that the Obama campaign can manage to keep the contraceptive issue alive with the help of Rush Limbaugh and company, and also to appeal issues that are of importance to everybody, like the economy, to these single women, that will be an important piece, if they succeed, of their success. And then there's this other up for grabs group, which are married women, suburban women, much less of a gender gap there. That's why you saw the reaction to Hillary Rosen. That's why Republicans who are not Rush Limbaugh recognize that they went way too far in their comments, because you don't have to be a single law student to be incredibly offended by those comments. I will close by saying one thing. I do think that, and I'm going to get myself in some trouble with anybody here who decided they liked me. I think the notion of, so I'm sorry, it was fun while it lasted, the notion that Democrats are peddling of a war on women, I think is overblown, overstated. There are issues of enormous importance to women at stake in this election, but it's absolutely clear that this election is going to boil down to, among other things, a war for women and for women's votes.
Great. Done. Thank you, Ruth. So, Carol, what does all of this mean for the issues that are closest to the heart of the breast cancer community at this point?
Well, thanks for painting that rosy picture. I want to pick up on something that Mark said before I get into some comments, though. And as you were outlining, Mark, or listing the national priorities that Congress is going to be facing, we are going to add one more priority to that, and that is ending breast cancer by 2020. That is our charge. That is why we're here today. That's why we're all going to take the information that we learn here and the experience that we have when we go on Capitol Hill Tuesday and activate the grassroots to do that. So what does this mean for advocates, and what role and what power do we have? Well, we're looking at the National Breast Cancer Coalition advocates. So we come armed with data, with facts, with the passion that instills us to be here, that challenges us to learn more. And since our founding, the National Breast Cancer Coalition has had one mission: the eradication of breast cancer. And through all the 20 years that we've been in existence, that we have never faltered from that mission. Every one of the strategies that we've employed, whether it be in not only funding research, but also making sure that advocates have a seat at the table as to how that research is structured or promoted, or what direction should go in, to begin with new, incredibly innovative strategies to address research. We know that giving money to a problem is not necessarily the answer. It has to be spent smartly, wisely, and strategically, and that advocates have to be at that table. So we changed the way we do research. We did that through Congress. We, amidst the financial crises in the country, I mean, it is getting challenging, and we know that. And you know, even in Massachusetts, where we really could pretty much count on all of our representatives and senators to sign on to this to funding for the DoD program. Even that is becoming challenging as well. You know, but we make that argument every year. We make it and we succeed because we won't take no for an answer, and we hold our elected officials accountable. So we'll be up on the Hill again for that. You know, but that was just one strategy of addressing the larger issue. We also focused on expanding access to care. We knew that without access to care, without quality care, that women would continue to not have access to the treatments that could save their lives. And so, you know, fairness became an issue here. You know, we advocated successfully for the Breast and Cervical Cancer Treatment Act. You know, we made the argument that it was unconscionable for women and women to be diagnosed with breast or cervical cancer through a free public screening program, a government-run screening program, and then not have access to the treatment that could certainly, save or extend their lives. I mean, that was morally wrong. And we made that argument. And we made it at a time when we were going through Congress at that time. It was a Republican Congress. They were not so inclined to expand Medicaid or any government spending, but we made that argument. And then we had to go back to all 50 states and make that same argument in our state legislatures so that every state would provide Medicaid coverage to these women. And we did that. We did it in record time. That's what we do. I mean, somebody said to me one time, that was a miracle. And I thought, it pretty much was, And as you mentioned, Ruth, we were, active in our efforts for the Affordable Care Act. Millions of women now and men have access to treatment, and they're not denied coverage, and there's some continuity in care there. But all of this hasn't gotten us closer to the goal of ending breast cancer. And there's a financial argument to be made here too. We have invested, whatever you want to call it, billions and billions of dollars in government-funded research and who knows what in the private sector in terms of research. And women are dying. The death rate is going down so incredibly in tiny increments. It was 42,000 or so people died from breast cancer in 20 years ago. Now it's 39,000 or so. That's a reduction of less than 1%. That's just not right for the millions that we've spent. So we have to make this a national priority. We've always known that breast cancer is a political issue, but we've never believed, and it is not, a partisan issue. Everyone is touched by breast cancer. Mothers, fathers now, men are having breast cancer diagnoses as well. This is an area that affects the very fabric of our society. And we cannot afford to continue to spend money on research and to have public policies in effect that don't maximize the investments that we made and don't have fairness in terms of the coverage that we have.
Which gets us to the Accelerating Breast
Exactly.
Cancer Research Act, and that's
right.
one of the arguments you and others will be making tomorrow, is the importance of that act. So say a bit about that,
Well,
Carol.
the Accelerating the End of Breast Cancer Act is really an act that would create a government commission that would oversee or catalyze what's been working, the research that's been done, look at new areas of programs areas of research that could be done, what's out there where collaborations could be formed, and get that moving. Get that moving so we can have the focus be on eradicating breast cancer. Now, the National Breast Cancer Coalition is really being the catalyst in this, in that we have held summits about preventing breast cancer in the first place. How do we stop metastases? This is what kills women and people with breast cancer. So, we need to have some government role in this. Breast cancer is too big an issue for the private industry to do, for just the government to do. We need everybody, activists, Congress, private industry, brilliant thinkers involved in all of this.
And this law doesn't require more money to be spent. It says, let's get some fundamental overarching approach to the money that we are spending and really direct things as wisely as possible.
I mean, some small money. This is this is a group that's going to sunset. It's a group that's going to be transparent and accountable and report out on what they're finding and have an end date. You know, by our deadline goal is 2020, and by the end of 6 months after that, this commission would have resolved itself. But
and just to point out, the Accelerating the End of Breast Cancer Act, which is H.R. 3067, for those of you who want to make a note of the number of the legislation, has 150 sponsors now. They'd like to get to, you all would like to get to 218 by Mother's Day. Let me come into Congressman Castle. Do you think that's possible? Do you think that within the Congress and the bitter partisan divide that we've been speaking about,
to go from 150 to 218?
Yep.
This is the group that can do it.
Okay.
Right here. I mean, if it's going to happen, it's probably going to take everybody here getting in touch with their member of Congress. I mean, based on, and I don't know a lot about it, but based on what I've just heard, it's something that makes eminent sense, and I would think it makes great sense from a political point of view, whether you're a Republican or a Democrat. And I would hope they would do that. Let me just say one thing about lobbying. We always hear about lobbyists and K Street and everything. Let me tell you, you are a far more effective lobbyist when you are in the room with your member of Congress or his or her assistant or whatever it may be. You're far more effective than any high-paid lobbyist. When you're a constituent and you're voting, that's what members of Congress really pay some attention to. So don't think that going and seeing members of Congress or their staffs is a waste of time. It's the single greatest way to get something done in the Congress of the United States.
Okay. And you heard it here. All right, let's just take a moment to recap what we've heard so far this morning. First of all, we have some good news and some not so hot news. Good news, if Ruth's right, the Affordable Care Act is withheld in June. Excuse me, upheld. Not withheld. Upheld, excuse me. Upheld, including the individual mandate. So a basis for the country to continue to move forward on this interesting experiment in the non-government takeover of healthcare, as Judy said, with about half of those who would gain coverage actually going into private healthcare insurance. So some good news there. Not so hot news from what Mark was describing, pretty much a continuation after the election of the status quo in many respects, with the president reelected, but Democrats holding a narrower margin in the Senate, Republicans holding a narrower margin in the House. We will note that there will be fewer moderates in both parties. And just recently in Pennsylvania, 2 moderate Democrats lost their primaries. So we will see potentially an even more polarized group of people both in the House and the Senate on both sides of the aisle. We heard that lots of big fights ahead, or maybe they're just those trash fires in New Jersey that Ruth talked about here and there, but clearly one coming over research, medical research. Ruth talked about the politics of austerity and the fact that given the fiscal pressures that are faced, continuing to make the argument about federal expenditures in research, whether it's through the National Institutes of Health and the NCI, or whether it's through the Defense Department's support of breast cancer research, that's not an argument that you can back off of. You're going to have to continue to make the point that that is necessary. And as you heard some difference of opinion there, whether Congressman Castle was right about research being a bipartisan priority, or whether Ruth is right that they're willing to throw that one under the bus in the interest of preserving tax cuts for the rich and everything else. At any rate, it suggests that you cannot back off that argument. And then finally, we heard from Carol that the importance of continuing to impress upon the Congress that we need to move toward the end of breast cancer by 2020 is not something that can go away. Whether there's a war on women or not, or a war for women or not, the war for ending breast cancer has to continue to move forward. So with that, we've got about 20 minutes left. We do want to open it up to some questions and observations from those of you in the room. So get ready for that in a moment. Before we get there, though, I want to come back to this question of really whether, if we think about the a congressional campaign that proceeds later this year with the Affordable Care Act in place, upheld, potentially a bunch of radicalized Republicans now, as Ruth suggested, Congressman Castle, objecting to this. What do you think that means for the ability of the parties to come together? They're going to have to make some very serious decisions about deficit reduction at the end of this year, the beginning of next year. What's the likelihood that some proposals about even holding the NIH budget level could survive in that kind of an environment?
I think the research budgets are going to be held at least level. I mentioned that I'm on the board of Research America, but the head of that board is John Porter, who was an appropriator of some significance, a moderate Republican, and he still goes and lobbies now on a regular basis on the Hill for those dollars. And my sense is that that's probably going to hold together before it's all said and done. And it will be, I'm going to tell you right now, most of this is going to be done in the lame duck session. And, there'll be a continuing resolution until they come back in November after the election or December. And you think, well, gee, maybe let's have another continuing resolution. Maybe they will. But if they do, they can still amend that continuing resolution or add to it so you could have more money or less money in certain areas. You've got to be careful about that as well. But my sense is that will at least hold up. And just one other thing on the politics of what's happening. I happen to, and this is probably heresy for a Republican to say this, but I happen to believe that if President Obama is reelected, he would be a stronger president, having learned from what, frankly, I would characterize as mistakes. He's had a terrible record of working with Congress, both Republicans and, in some cases, Democrats. And I think he would do much better in a second term. I also believe that Governor Romney has and I don't know him that well, but he has a great sense of awareness and ability to work with people. Based on what I've seen, he'll be a good leader. So I think either way, we're going to have a president who will do a better job in the next 4 years than in the last 4. You can go back further than that if you want, years, which
Mark,
we would hope for.
do you agree with that?
I hope he's right. I hope he's right.
About President Obama being a stronger president, or about Mitt Romney being a good president?
I hope he's right, depending on who wins. Okay. One or the other. They're both really serious people. They're both in public policy for the right reasons. They both have records of working with people in the other party. But again, I worry about the conduct of the campaign, not leaving the winner in a place where he can actually do those kinds of things that would be necessary.
Okay. Judy?
No, I think that Mark's raising the right concerns. When you stake out very strong positions, and I talked about the two different visions of healthcare, the role of government in healthcare, then you have staked those out, and deviating from them makes it challenging. Governor Romney likely to be beholden to the conservative constituencies as he goes forward, despite his record in Massachusetts. And I see challenges for President Obama. I think that he will be powerfully committed to establishing a legacy in the Affordable Care Act. I also think that he is powerfully committed to getting the nation's fiscal house in order, and I think that there are some good ways to do that and some not good ways to do that. And my hope is that the advocacy of this kind of group keeps whomever's elected, although it's clear whom I want to see elected, but keeps them accountable for not just on the research front, but on the access to affordable care for not just through the Affordable Care Act, but through Medicare and Medicaid.
So, Mark, here's another question for you that came in from the audience. How likely do you think President Obama is to really focus on women's issues during the campaign? Is he going to make this a war for women? And if he's not going to do much, you can answer that one way or the other. What about his wife, Michelle Obama?
I mean, they'll both do a lot. They believe in it, and it's politically vital for them to win. The election, the president is unlikely to win male voters, so he must win female voters by a higher percentage. I've done this on the Advocate several times. He's got to win women more than by Governor Romney wins men if he's going to win. And his focus will be relentless, and you'll see it fought out in rhetoric in the campaign trail. You'll see it in the advertising, and you'll see it a lot in close coordination with Democrats in Congress, where they'll try to force votes, particularly in the Senate, that try to frame the debate around these kind of budget choices about, we're seeing it now over student loans, which obviously doesn't just affect women, but you'll see a range of fights on those issues and no matter what the Supreme Court decides, a lot of them will be health care trade-offs where they'll target women voters in particular to say, these are the choices you face. This is what a second Obama term would be like versus a first Romney term.
Ruth?
What Mark said. Both of them are going to, it's absolutely clear what the Obama campaign's role is going to be and what its strategy is going to be. And it's interesting how much that is in sync right now with the congressional schedule. There's an Equal Pay Act issue coming up this week, and they are just going to keep hammering that and hammering that. The interesting thing, which we haven't quite seen yet, Governor Romney started with the, well, no, it's the Obama administration that's waging a war on women, and 92% of the jobs that have been lost have been women's jobs. That didn't, I think, move people very much. It's going to be interesting to see the degree to which he promotes a sort of positive agenda in that way. I do want to go back and say one thing about the previous question. The lame duck, it's probably going to be a moment, it's going to be a moment of sort of fiscal peril, really, because we're facing so many cliffs at the end of the year. Something is going to be fixed, but it is going to be, I think, very temporary, short-term, and inadequate. Yes, another can kick down the road. And one of the things that depresses me most during this campaign is the mismatch between the seriousness of the moment and the size of the stakes on the one hand, and the absolute vacuousness of the campaigning from both candidates who are campaigning to win and not campaigning to govern. There's two perfectly legitimate alternative universes that each campaign could set out about what it imagines the tough road ahead to look like, but neither one is willing to do that, and they're just absolutely failing everybody in this room and everybody outside this room, and I wish they would step up.
I think you noted in a recent column that the Obama campaign's adoption of the motto "Forward" was particularly unenlightening. Yeah. But as you pointed out, I think it was your colleague who pointed out, "Reply all" was taken.
Reply all was taken, and Sideways didn't poll that well. So.
Right. So Mark has to leave shortly. So Mark, I'm going to ask you one last question, which is, Game Change was all about, in part, aspiring presidential candidate, John McCain, picking a very, very different, out-of-the-box candidate to run with him on the ticket in the form of Sarah Palin. Who is Mitt Romney going to pick? And will it be as out-of-the-box a choice as that one was?
I'm convinced he's going to pick Rob Portman, the senator from Ohio. I think it makes the most sense by far. He's popular in his state, but Governor Romney, I think, is looking for three things. He's looking for someone who is instantly perceived as qualified to be president. He's looking to pick someone he'd like to serve with in the White House, and he's looking for someone who he thinks is intelligent. And I think, looking at the list of prospects that we know about, Governor Romney may have other names in mind that have mentioned. A lot of Republican presidential candidates in the recent past have picked people like Jack Kemp and Sarah Palin and Dan Quayle, who weren't at the top of the mentioned list. But I think right now, looking at what I believe Governor Romney wants and the available prospects, I think he's far and away the most likely to pick Rob Portman. And the thing about Rob Portman, besides the fact that he's got a lot of qualifications, is Democrats like and respect him. They think he's qualified, and they like him a lot. He's one of the most popular Republicans on Capitol Hill amongst the other party. And I think as a governing pick, that could be an outstanding thing if there was a Romney Portman ticket and governor, and they did win.
Does it do anything for the gender gap?
Maybe. I mean, he's done well with female voters in Ohio, but I think it's really less about the gender of the person and more about what they talk about and how they relate to people. And again, I think for the people he might pick, I think Senator Portman is as likely as anyone to help him with that issue.
Okay. Well, Mark, we know
I apologize. I need to run, but I appreciate you all and your effort, and thank you so much for serving and trying to help the country. Appreciate it. Good job, Mark. Thank you.
All right. I'll move everything.
I happen to agree with what Mark just said. I think it is going to be Rob Portman, and I've worked with him. I think he's a very qualified fellow. I think the different choice would be Marco Rubio, who I don't think really wants to do it. But my sense is that the Midwest, the Ohio connection, Rob Portman's a very qualified guy, is the likely vice presidential choice, if I had to guess.
All right, Judy, and a question for you. As we know, the Affordable Care Act, even if fully implemented, would probably enroll around 30 million people in this country. That still will probably leave about 20 million people without coverage. Now, some of those will be undocumented immigrants, but others will not. So is, this questioner asks, is just single payer completely off the table, or what are we going to do with these 20 million?
I don't know who that questioner was, but I think we ought to give her a round of applause. Because of her commitment to really getting everybody covered without question in a relatively simple, straightforward way. What I believe is, and have long believed as long as I've been active on this issue, which is a very long time, is that we built our healthcare system in a complicated way from political choices over time, not going the way other nations did with a government, a national program. And we have built it around employer-sponsored health insurance, which not only special interests, but the people who have it value. And that is that to hold any change hostage to getting a total transformation, I've always thought was the wrong thing, because it was leaving too many people uninsured, while some people pursued their vision of the best. So at this moment, I'm loving Ruth's projected outcome for the Supreme Court. I believe that will be a tremendous boon for President Obama in terms of legitimizing the law and enable us to move what is, even though there's a lot of turmoil, it is moving forward. We need to move it forward, and takes too damn long to get everybody covered. But that's where I believe that our energies are best put, because we can do one hell of a job to improve people's lives that way.
Great. So here's another question, and Congressman Castle, I'd love to hear your thoughts on this. This questioner is pointing out that the House-passed budget would essentially call for very large cuts in discretionary spending and pretty much make impossible any increase in the budget of the National Institutes of Health, let alone many other forms of medical research. So how could, this questioner asks, how could GOP members of Congress commit to the goals of the National Breast Cancer Coalition, ending breast cancer by 2020, and support the Ryan budget, unless it's possible for people to say one thing and do another, which might be the case. But independent of that, how do we explain the support for the framework of the House budget on the one hand, and what you say is the commitment to medical research and the other the other goals of the NBCC going forward?
So this questioner said that politicians might say one thing and do another. I can't believe I heard that. Politicians in general will do that. They'll say they're sort of for something, and they'll say, well, for particular reasons I couldn't vote for this, or whatever it may be. So that's not that unusual. I mean, it's true of both parties and most politicians at some point in their careers. That Republican budget, which I don't necessarily support, but that Ryan budget is a very conservative budget. It essentially tries to deal, although it didn't go as far perhaps as it should go, in terms of the deficit problems of the country, which obviously add to the debt of the country, and that is sort of the raison d'etre for it, and why people voted for it. So they can say we're for balancing budgets or whatever it may be. Some of the details are not something that they necessarily would have supported. They separated out. They might say, "Oh, no, I would still support healthcare research or whatever it may be." I don't think that was necessarily part of that particular vote. Having said that budget never was going to go anyplace. If it ever could pass in the Senate, the president would have vetoed it, but it wasn't going to pass it in the Senate, as the Senate's made up now. So it was always just a political statement one way or another. And I personally didn't agree with it, and I don't know how Governor Romney is going to explain his lip service, at least, in support of it in terms of the politics, because I think it has some downsides to it as well.
Do you see
there's no easy answer to the question.
Do you see the Republican Party backing off its objection to new revenues ever over the next couple of years?
Well, that's a good question. I think the answer is you almost have to. You all are probably familiar with a couple of the proposals that came along that would have called for slight revenue increases and substantial reductions in spending. And I happen to have favored that particular concept. And if you're going to get the reductions that individuals, Republicans and other individuals want in order to balance the budget, you're probably going to have to offset it with some revenue increases just to get the votes that are needed. And you're going to deal with this with the Bush tax cuts in the lame duck session. I don't know how that's going to come out, but that's going to be an issue. But I think ultimately, my sense is that the next president and the election are going to be such that there will be some balance. You know, the Simpson-Bowles proposal, which was the one that basically had revenue increases and reductions, or something similar to it, will be adopted maybe not in the lame duck session, but in the next year, regardless of which party is in control.
All right, well, as we wind our way toward conclusion, I want to ask each of you to imagine that we are sitting here a year from now. So it's 2013. I want you to tell me, we're 1 year closer to that 2020 deadline, by the way, right? 7 years instead of 8. I want you to tell me, looking back, what happened toward the end of 2012 with respect to the issues we've been talking about. What happened to the Affordable Care Act, what happened in the election, who controls the Congress, and pretty much what is the agenda going forward a year from now for this community, taking into account all of the changes that you will have thought have occurred to that point. And the reason I want to frame that is to get us to think about what is truly the most likely outcome and where this group has to be headed a year from now, thinking about the opportunities that will exist a year from now to push forward on this agenda. 1 year closer to that 2020 deadline. So, Carol, briefly, we'll start with you.
Well, I think accountability of our elected officials, and we do hold our representatives and senators accountable for the positions they take, the actions they take. Do they do what they say? We will be collecting signatures for the Accelerating the End of Breast Cancer Act. Our goal is to have that passed this year, but if you're asking realistically, you know, we're charged with going out and growing our grassroots, creating a groundswell of public support, not just among breast cancer advocates, but other groups, women's groups, policy groups, everyone, families, everyone, because we all have a stake in ending breast cancer, and really make that earth rumble beneath their feet. And if they don't if they don't sign on to the Accelerating the End of Breast Cancer, we hold them accountable. And we write letters to the editor for what their positions are. We show up at public rallies. We show up at town hall meetings. We show up at their offices. But we make this a key issue in the political elections. Same thing in the Senate. So I think that we have to be positioned to really, this is going to take work, it's going to take a lot of work, it's going to take efforts beyond all of us, but we have to get that message out there, and as I said, rumble the earth beneath their feet.
Okay, so we're just going to continue down the line to wrap this up. I need you all to keep these sort of Twitter-length comments, if you would, 140 characters. Ruth, what's it like a year from now? What's the agenda?
President Obama reelected, House Republican, Senate, House more narrowly Republican, Senate even more narrowly Democratic, fiscal cliff, roadrunner, look down, come to an agreement, the president, Speaker Boehner, reach some agreement that is inadequate and has some magic fudging in it on revenue with things like dynamic scoring of the impact of tax cuts. Boehner loses his speakership, as long as I'm imagining. Boehner loses his speakership with a revolt of Republicans, but delivers enough Republican votes to save the country and go down in the history books.
Okay, so you got 10 characters left. What's ahead for breast cancer a year from now?
Breast cancer, I hate to say this, not a focus of the debate, but funds are constrained by the part of the Obama-Boehner deal.
Okay, so that's where you got to be a year from now, folks, focused on the notion that funding is going to be constrained unless you make a lot of noise. Judy.
So I'm taking this projection up to the fiscal deal, looking over the cliff. I wouldn't be surprised if a year from now we're still in that battle. And whether it is the research dollars or the adequacy of Medicare and Medicaid protections and the security of the Affordable Care Act, I think that that will be most definitely on the agenda of this group in a year from now. And I would point out that a year from now, with this prognostication about what happens with the law, we will be on the verge of implementing an expansion of coverage to not everybody, but to 30 million people. And that it will be not an easy job to make that really happen. And I hope that making it happen as rapidly and as effectively as possible will be on this group's agenda, because you guys can carry it off.
Okay, great. And Congressman Castle, your
Okay.
last 140 characters.
The House will be Republican. Boehner will be the Speaker. The Senate will be dead even. The presidential race is, I think, impossible to call right now, and I think it's going to depend upon the economy and things we just don't know about at this point. With respect to health care in general, I really don't know what the Supreme Court is going to do. I got a hunch they're going to do. I don't think they're just going to uphold all of that act as it is. They may take it apart in certain ways. I doubt if they're going to declare the whole act to be null and void. But we'll see. I mean, we just don't know. But no matter what they do, there's going to be reaction to it one way or another. And that reaction is going to lie around the funding of it, which Republicans can hold back to make sure things don't move forward. So the various things that can be done. So the pressure is going to be needed. As far as medical research is concerned, again, you are the single strongest force I know of out there, collectively, all of you. So go about your job. It's vitally important. You are saving people's lives, and I can't encourage that enough. I believe that you can be the winners in all of this.
So what he said and what they all said. Good luck to all of you tomorrow. Join me in thanking this panel for a terrific discussion.